Hi friends, welcome to the channel The Nurse. Here we are discussing about medical and surgical nursing questions and answers with their rationales. So if you are not subscribed to our channel, please subscribe. We will move to the topic, that is medical and surgical nursing questions and answers with their rationales. First question: which of the following is not a symptom of hypoglycemia? Shakiness, rapid heart rate, blurred vision, flushing. Correct answer is flushing. Flushing is not a symptom of hypoglycemia. Hypoglycemia can cause shakiness, that is tremor-like feelings, rapid heart rate, that is tachycardia, and blurred visions due to the low blood sugar levels. Then second question, a nurse is caring for a patient with COPD. Which of the following intervention should be avoided to prevent exacerbation? Administering high level of oxygen therapy, encouraging deep breathing exercises, providing adequate hydration, administering bronchodilators as prescribed. So here correct answer is administering high levels of oxygen therapy. So whenever a COPD patient require oxygen, then lower level of oxygen therapy only you should administer. That is up to 2 liter. Administering high levels of oxygen can suppress the respiratory drive in patients with COPD and can worsen their condition. Other interventions such as encouraging deep breathing exercises, providing adequate hydration, and administering bronchodilators as prescribed are appropriate for COPD patients. So only low level oxygen administration should be administered for COPD patients. Which of the following is not a common symptom of meningitis? Fever, neck stiffness, nausea and vomiting, joint pain. Here correct answer is option D, that is joint pain. Meningitis is an inflammation of the protective membrane that surrounds brain and spinal cord. Symptoms of meningitis, common symptoms of meningitis include fever, neck stiffness, and nausea and vomiting. These are the common symptoms of meningitis. Joint pain is not typically associated with meningitis. Then fourth question, a patient with a history of congestive heart failure presents with the shortness of breath, coughing and wheezing. Which of the following medication would be the most appropriate for this patient? Furosemide, that is Lasix, prednisolone, deltasone, that is a trade name, metformin, warfarin. So here correct answer is furosemide. Furosemide, it is an example of loop diuretics. It will increases the urine output, then that the fluid will reduce. So that will reduce the symptoms also. Furosemide is a loop diuretic that can help to relieve fluid buildup in patients with the congestive heart failure, which can alleviate shortness of breath, coughing, and wheezing. Prednisolone, that is a corticosteroid that is used to reduce inflammation, but it is not typically used in the treatment of congestive heart failure. Metformin, that is an OHA, that is oral hypoglycemic agent used to treat diabetes, and warfarin is a blood thinner used to prevent blood clots. So these are the other options: prednisolone, metformin, and warfarin. Then fifth question, a nurse is providing discharge instruction to patients who underwent a total hip replacement. Which of the following instruction should the nurse include? So that is an important point. That is which option should include? Options: avoid crossing your legs while sitting, walk with a wide gait to maintain balance, apply heat to the incision site for pain relief, sleep on your stomach to alleviate pressure on the hip joint. Correct answer here, avoid crossing your legs while sitting. It will leads to further hip dislocation. That is why the nurse should tell the patient or tell the family members to make them sure the while sitting the patient should avoid crossing his legs. Patients who Patient who undergo total hip replacement surgery need to follow specific precautions to ensure proper healing and to prevent dislocation of the new joint. Crossing legs while sitting can increase the risk of dislocation. Walking with a wide gait, applying heat to the incision site, and sleeping on the stomach are not recommended post-operative instruction for total hip replacement. Then sixth question, a patient with history of hypertension is prescribed lisinopril. Which of the following statement is true about lisinopril? It is a beta blocker, it is a calcium channel blocker, it is an angiotensin converting enzyme, that is ACE inhibitor, or it is a diuretic. So here one clue is pril. So how to identify? Correct answer here option C, that is lisinopril belongs to an ACE inhibitor, angiotensin converting enzyme inhibitor. So angiotensin converting inhibitor medicines will end in pril. Lisinopril is an ACE inhibitor that is used to treat hypertension. It works by blocking the conversion of angiotensin 1 to angiotensin 2. That is ACE mechanism, which causes vasodilation and reduces blood pressure. Beta blockers, calcium channel blockers, and diuretics are other classes of antihypertensive medications. Seventh question. A patient with a history of coronary artery disease complains of chest pain. Which of the following intervention should the nurse prioritize? Administering pain medication, placing the patient in a supine position, administering nitroglycerin as prescribed, providing emotional support. Here correct answer is option C, that is administering nitroglycerin as prescribed. Nitroglycerin will dilate the coronary arteries, then it will alleviate chest pain. Chest pain in a patient with a history of coronary artery disease could indicate angina or heart attack. That is because of the lack of oxygen supply to the particular heart area. Then pain will start. If vasodilation occurs after nitroglycerin, it will helps to provide more oxygen to the particular heart. Then the symptoms pain will reduce. That is a method of action of nitroglycerin. Administering nitroglycerin as prescribed can help relieve chest pain by dilating the blood vessels, mainly coronary artery vessels, and improving the blood flow to the heart. Pain medication and emotional supports are important intervention, but the priority is to alleviate chest pain. So nitroglycerin need to administer. Eighth question, which of the following is not a typical side effects of chemotherapy? Nausea and vomiting, hair loss, fatigue, tachycardia. Correct answer here, tachycardia. Tachycardia is not a typical side effects of chemotherapy. Other options includes nausea, vomiting, hair loss or alopecia, fatigue. These are the common side effects of chemotherapy, but tachycardia not associated with chemotherapy as a common side effects. Chemotherapy is a common treatment for cancer that can have side effects such as nausea and vomiting, hair loss, and fatigue. Tachycardia or a rapid heart rate is not typically a side effect of chemotherapy. Ninth question. A patient is diagnosed with a deep vein thrombosis or DVT. Which of the following interventions should the nurse prioritize? Administering oxygen therapy, administering heparin as prescribed, placing the patient in a Trendelenburg position, administering a beta blocker. Correct answer is administering heparin as prescribed. That is important intervention in the case of DVT. Deep vein thrombosis or DVT is a blood clot that forms in a deep vein that usually occurs at legs. Treatment typically involves anticoagulant therapy such as heparin to prevent clot from getting larger or breaking off and traveling to the lungs. If it is reached in lungs means that will cause pulmonary embolism. So, in order to prevent pulmonary embolism, we need to administer heparin as a precaution. Administering oxygen therapy, placing the patient in a 10 labor position, and administering a beta blocker are not appropriate intervention for DVT. 10th question. Which of the following is not a common symptom of hypothyroidism? Fatigue, weight gain, heat intolerance, cold intolerance. Correct answer is heat intolerance. Heat intolerance is not seen in hypothyroidism, but it is seen in hyperthyroidism. The main common symptoms of hypothyroidism include fatigue, weight gain, cold intolerance, but heat intolerance is seen in hyperthyroidism. Hypothyroidism is a condition in which the thyroid gland does not produce enough thyroid hormone. Symptoms can include fatigue, weight gain, and cold intolerance. These are the common symptoms related to hypothyroidism. Heat intolerance is a symptom of hyperthyroidism, a condition in which thyroid gland produces too much thyroid hormones. 11th question. A patient with history of heart failure is prescribed digoxin. Which of the following is a sign of digoxin toxicity? Bradycardia, hypotension, hyperkalemia, visual disturbance. Correct answer is visual disturbances. Halos around the light. Digoxin is a medication used to treat heart failure and arrhythmias. It can have side effects such as nausea and vomiting, headache, visual disturbances, that is halos around the light, which can indicate digoxin toxicity. Bradycardia and hypotension can also be symptoms of digoxin toxicity, but visual disturbances are a hallmark sign. Hyperkalemia is not a common side effect of digoxin. Sometimes hypokalemia occurs. A patient with chronic obstructive pulmonary disease or COPD is prescribed ipratropium, that is ipratropium bromide. Which of the following is the correct administration technique for ipratropium bromide? The common trade name is Ipravent. Administer via inhalation, administer subcutaneously, administer intravenously, administer orally. Correct answer here, administer via inhalation. Ipratropium bromide, that is usually administered through inhalation, or sometimes we can use it as a inhaler, or we can use it as a nebulization medication. So both ways we can use as an inhaler or nebulization. Both type we can administer through inhalation. Next, ipratropium bromide is a bronchodilator used to treat COPD. It is typically administered via inhalation to deliver the medication directly to the lungs. Subcutaneous, intravenous, and oral administration are not appropriate routes for administration for ipratropium bromide. 13th question. A patient with diabetes is prescribed metformin. Which of the following is a potential side effects of metformin? Hypertension, hypoglycemia, hyperglycemia, gastrointestinal upset. It is a confusing question. So I will explain you. Most of you answered hypoglycemia. So the hypoglycemia also one of the complicated side effect only. So here I will explain you. Metformin is an oral hypoglycemic agent used to treat type 2 diabetes. It can have side effects such as gastrointestinal upsets, including nausea, vomiting, and diarrhea. Hypertension and hyperglycemia are not common side effects of metformin, but hypoglycemia can occur if the patient takes too much medication or skips a meal. So in both conditions, hypoglycemia may occur. Otherwise, common side effects of Metformin includes gastrointestinal upset that may be nausea, vomiting, or diarrhea. 14th question. A patient with history of deep vein thrombosis or DVT is prescribed warfarin. Which of the following is potential complication of warfarin therapy? Hypertension, hyperkalemia, bleeding, hypoglycemia. Correct answer is bleeding. Bleeding is the common side effects of warfarin therapy. Warfarin is an anticoagulant used to prevent blood clots. However, it can increase the risk of bleeding, which is a potential complication of warfarin therapy. Hypertension, hyperkalemia, and hypoglycemia are not common side effects of warfarin. The last question today. A patient with chronic kidney disease or CRF is prescribed with epoetin alpha. Which of the following is the therapeutic effect of epoetin alpha? Decrease in blood pressure, increase in red blood cell production, increase in urine output, decrease in potassium levels. Correct answer, increase in red blood cell production, RBC production. So usually erythropoietin that is produced at the kidney when CRF or chronic renal failure is there means the erythropoietin production will be low. So it will not produce adequate RBCs. So in that cases we need to administer additional erythropoietin supplements, then only RBC production will increases. Epoetin alpha is a medication used to stimulate the production of red blood cells in patients with the chronic kidney diseases who are anemic. It does not have an effect on blood pressure, urine output, or potassium levels. These are the other options. So I think it is clear. So that is about today's video. We have discussed 15 questions of medical and surgical nursing. And if you have any doubt means you can ask in comment section. And if you like this video means you can share with your friends and ask them to subscribe our channel, The Nurse. And we will discuss more questions in coming days. So please stay tuned. Till then, bye.